Hello everyone and welcome to my channel. I'm Mariam, an internal medicine trainee based in the UK, and I share my experience along the way. I know it has been a while, but I promise to be more active on this channel. As the topic says, I am talking about my PACES experience. I'm sure if you're watching this video, you already know that PACES is the final exam of the membership of the Royal College of Physicians of the UK, and it is notorious. Transparency alert, I failed my PACES once, and honestly, it was really painful. But an honest and probably not popular comment is that PACES made me a better doctor. I'll therefore start answering the questions that were my own questions when I was first starting my PACES prep. Where to start from? I totally appreciate how overwhelming it is when you first start your PACES prep. There's so many things going on. There's so many people talking about steps, different stations, and you're like, oh my God, where should I start from? Most accessible and free materials are YouTube videos. Simply search PACES exam and you would see endless examination and mock test videos and other doctors' experience like this video that you're watching at the minute. Just bear in mind that PACES has slightly changed in 2023 with changing the consultation stations to 2 separate stations and also having a bit of a change in ethical and communication stations. Best thing ever is the MRCP website itself. They have sample scenarios and even videos, and most importantly, the marking sheets. If there's only one advice, know the PACES mark sheets by heart, because that's where you end up failing or passing. There are other free PACES materials as well, such as the podcast. The best one is the Pre-PACES podcast by Sam Williams, as I used to listen on my way to hospital on a daily basis. Most of the IMTs try to have an internal PACES group where they share good cases in hospital, and some of them might even have teaching sessions, so don't forget about them. One of the best resources you could use is the online examination videos. The different websites and revision tools. Most reputable one is PASTEST, which has always been a great revision tool for all parts of MRCP anyway. They have different videos based on the new PACES format. You can start with their examination routine videos and then move on to the examination or consultation station, where literally whatever comes in PACES is in there. You can get a little discount on all their MRCP revision material using my link. What I personally did is that I watched the examination routine videos, not only from PASTEST, but also from other YouTube videos, and came up with a routine that I'm comfortable with. Then I repeatedly examined my partner to make sure that the routine sticks in my mind. Once the routine was established, I practiced timing myself with another friend who was practicing to make sure we can finish the routine in 4 to 5 minutes. Because obviously in the exam you would have patients with abnormal findings, and you want to take your time to listen or take extra steps for that finding. I think this is quite a solid plan on how to start, because closer to the exam, if you struggle with your routine and you're not slick, you would definitely be extra stressed, and you don't want that. So when to start? Obviously, I failed my exam once, so tough to say based on my own experience, but first time round I started mid-August and my exam was early November, and I failed only with 1 mark down, so I would say 3 months of solid practice should be fine. Because you're already a good doctor, you have the knowledge, you just need to shape it into the PACES format, and to be honest, it is a good format. PACES practice needs dedication, so you would end up in hospital out of hours, on your annual leave, and even on your 0 days. But don't forget to book study leave to prep for your PACES. Should I attend a course? My short answer is yes, but I have a separate fairly short video explaining the benefits of the courses and who might not need it. Generally speaking, if you're working in a tertiary hospital with different specialist wards and clinics with supportive colleagues, you do not need to attend a course. But if your course is paid for, you might as well use it to help to pass your PACES, because it is a tough exam. If you're not attending a course, you need to be extra proactive in finding PACES appropriate patients. Take your outpatient clinic time to attend specialist clinics like pro procedure, to examine patients in front of an expert consultant so that you have seen a good case, got your feedback, did a clinic day, and also possibly did a procedure as well. You would be surprised that most of the PACES appropriate patients are not actually admitted to hospital. Most of the hospitals have a supportive PACES group where they share good cases. Always attend the patient ASAP, as they might be discharged, the finding might go away, or even the patient might change their mind and do not let you examine them later. If you're attending a course, I would surely advise to take the course when you are semi-ready. I have talked more about that in the PACES course video. Probably 3 to 4 weeks to your exam is perfect, as you have enough time to fix anything that needs to be fixed. What resources to use? You have already subscribed to PASTEST, which is probably just perfectly fine, but sometimes you might need extra. I used UpToDate as my main resource to go through pathophysiology and differentials, but I can confess that might take a long time. Neurology was my weakest station, so I took my time to learn how to classify the diseases and how to come up with reasonable differentials. For the management part, of course, UpToDate could be useful, but I personally preferred the NICE guidelines as they're more UK appropriate and that examiners like to hear more from you. BMJ Best Practice was my best friend to navigate through some of the guidelines, because some of them are society guidelines such as asthma, pneumothorax. There are a few good and free websites that would give you a good structure at the beginning until you find your own mind maps and your own routines. Plowing through PACES and LearnHeme were the ones I used most often. There are a few books that are famous out there for PACES. I used a couple of them and found them really helpful. One was Cases for PACES, which is a great book for final revision and a quick look through, but obviously not thorough. I remember using it more often during my final revisions. The other one that I used was the Pocketbook for PACES. Great book, especially when you are starting your PACES prep, as it could be excessively thorough in some parts. I personally used to make my own notes on Notion, which was absolutely game changer, and I managed to revise all my notes 2 days before my exam. Do I need any equipment to practice for PACES? Absolutely. I have upgraded my stethoscope from the classic one that I had since med school to the Cardiology 4. Probably one of the best decisions that I've ever made. Try to practice with the same stethoscope that you're taking to your exam. The digital stethoscope are not generally favoured, but it depends on your host examiner or organising registrar. I would definitely take my own pen torch and the fob watch to the exam, as during the exam you're too stressed to look for them. So it would be a good idea to start practicing using your own. So I used to put them on the bit of my pocket, so whenever I was going to examine a patient, I would just put it out and start seeing a patient. For the neurology examination, I got myself a reflex hammer, a tuning forks, and neuro tips, and specifically had a red hat pin and a pocket snell chart for the IELTS examination. I did not have an ophthalmoscope, but I was generally comfortable using them. You can borrow them from your emergency department, or AMU's normally got one, and practice with them. Make sure you know how to use an ophthalmoscope properly before attending your course, because there you want to maximize learning the findings rather than the ophthalmoscope technique. So how to practice? As I said earlier in how to start part, knowing your routine is the first thing. Practice on your partner, friend, kid, or even a pillow until you master the steps. You want to be slick, finishing everything in 45 minutes. I use Simpleoski website to track down my steps and make sure I do them all. Find yourself a few study partners, but make sure that you're practicing with no more than 2 people at the same time, as it significantly affects your practice. First round of PACES, my study partner's exam was earlier than mine, so her practice pace was much faster than mine, and towards the end I feel like, oh my god, I'm so behind. So remember these mind games as well. Don't forget that online practice could be extremely useful, especially for ethical and communication stations where you do not even need to have a PACES candidate study partner. Any of your doctor friends could be very helpful. Even with the consultation stations, we practiced online, taking the history and verbalizing what we wanted to examine and what we were looking for by cutting 2 to 3 minutes off the timer. Start watching patient examinations and actively look for PACES appropriate patience. Do not delay real practice because you have not watched all the videos or revised anything. Honestly, go for it. I know I have emphasized on colleagues' feedback, but beware that some might be opinionated, some might just be wrong, or they might have just forgot how PACES works. Always take the feedbacks with a pinch of salt. Once you're almost ready, attend a course to consolidate your knowledge and do a mock test. Don't overthink it. PACES is just an exam and a step. It does not gauge your medical knowledge and performance as a doctor. Luck is an important factor in PACES, but stress management is definitely the best technique to pass your PACES. Best of luck for the exam ahead of you. Don't forget to subscribe and like this video.